For 50 years in this country, we've been debating how to help people who aren't insured. And the assumption is once you get them the card, they are protected for the rest of their lives. And we're going to take you in a world where seriously ill people with insurance, including Medicare, are facing staggering bills. It has nothing to do with the dialogue we've been having for 50 years. You cross the Rubicon, now you're safe. So let's just do this very quickly. First is buried in every story about, first slide, healthcare in America is 1 in 6 people who are extraordinarily ill over a 3-year period. And so the people in our sample, 100% of them were hospitalized at least twice, said they had a serious illness. A quarter of them were hospitalized 5 times in 3 years. They were mostly seeing 5 doctors or more, so you talk about information coordination. They are taking 5 or more prescription drugs. And just to show, we'll show in a minute, insured America, 1 in 10 had $50,000 a year of prescription medication bills. And these are people who in fact say they're seriously ill, and they have one of the major killers. So these are not routine patients at all. Let's just take a look at what happens. Next slide. So the gray bars are all 91% of people, good news, had a health insurance policy. Wow, I can feel good about that. Here it is. I have a health insurance policy. 53% of people with a health insurance policy had serious medical bills. They had problems paying it. And so a third were hospital, but I'm insured. A third, prescription drugs, emergency rooms. These are not stories about the uninsured. These are stories about people who have an insurance card. All through our poll, each section we ask you what worries you most. Mostly, I don't know what I can pay for this. Suddenly they're being told that this policy that they're lying in a bed with is not going to do that.